Hello and welcome to the Leprosy Mission's second series in our podcast, Serve from Your Sofa. Even though the restrictions imposed by the COVID-19 pandemic have eased significantly from our first series, we still want to encourage you to serve right here in Northern Ireland and even from your sofa if you still wish. We want to share how you can enable change and transformation in the lives of leprosy-affected people across the world. In doing this, you become an everyday missionary for the Leprosy Mission. Someone who simply has a passion to continue Jesus' work of caring and helping some of the most rejected and outcasted people in our world. With his leading and guidance and your support, we will make leprosy a thing of the past. In this series, we will hear from people across the Leprosy Mission. In this first episode, we will be hearing from Jannine Ebenso from the Leprosy Mission International, and we will be discussing research in the Leprosy Mission and how you can enable this vital area to grow. So let's get started and enjoy! So, hello Janine, it is so good for you to join us in our second series of our podcast, Serve from Your Sofa. It'll be a lovely change from the first one to have another voice that's just not mine. And obviously it'll be so good just to hear from you, who is so knowledgeable about the topic that we're going to discuss today, and you obviously know much more than I would, so it is great to have you. So what we're going to talk about today is research within the Leprosy Mission and how key it is for us to achieve our goal of zero leprosy transmission by 2035. But before we jump into that, I'm very aware that a lot of our listeners might know who you are. So maybe if you want to introduce yourself, tell us a wee bit about yourself, how you came to the Leprosy Mission and what your role is.
Thanks, Rebecca. Yeah, my name is Jannine Ebenso. My surname is a Nigerian surname. I'm married to a Nigerian doctor. And I trained as a physiotherapist originally, graduating in 1988. And after working with the NHS in Merseyside for 3 years, I joined the Leprosy Mission. And at first they sent me to Bible College for a year. And then after that, I went to Nigeria, where I served as a physiotherapist and a disability advisor. So I went to Nigeria in 1992. In 2008, so I was in Nigeria 16 years altogether, I returned to England with Bassi, my husband, who came over to Leeds to study for his PhD. And since then, I've worked at the international office, which is based in Brentford. And I've had various roles for the first few years, were still mainly to do with disability and leprosy. But my current role is as head of quality assurance. I'm a member of the international leadership team, and my role is to oversee and lead on things like policies and standards, and particularly on research and learning. So that's a bit about me.
Wow, it's amazing just to hear your journey and just see how your role has just evolved within the Leprosy Mission. So that's so exciting that you have that experience of working on the field and actually seeing all this stuff in practice firsthand as well, which is great. So why don't we just jump straight into research. And probably if you're anyway like me, when you hear the word research, your brain probably automatically jumps to this person sitting in a laboratory with their little microscope, and that's really what many of us jump to. I know before I started reading into everything when I first started my role, that's probably what I would have thought of, but there's so much more to research than just that. That's just a portion of it, really. So can you maybe give us a short glimpse into the different areas that TLM are involved with research?
Yeah, you're right, Rebecca. Our research is quite varied, and a lot of it does take place in a laboratory. but a lot of it also takes place in our community projects, in our leprosy control projects, and also in our human rights and advocacy work as well. A lot of it has research attached to it. And I believe you said you've spoken with JIPTA. JIPTA has a big advocacy project over in Bangladesh, and a part of that is to do small research projects looking at things that help the Bangladesh team to understand leprosy in the Bangladesh context much better. So leprosy research is quite varied. One of the first things that we do is trying to understand better how leprosy is transmitted. Leprosy is an infectious disease, but even after all these years, we don't fully understand everything about transmission. There's a lot of gaps in our knowledge. So we're aiming to end the transmission of leprosy. If we don't understand transmission well, it's a little bit difficult to stop the transmission. And the Leprosy Mission's Stanley Brown laboratories in Delhi, India, are conducting all kinds of studies to help us understand transmission. And one of the recent things that they've told me about is that they have done studies and they've taken samples in communal bathrooms. So a lot of the communities where leprosy exists, there are communal bathrooms. Each house doesn't have its bathroom. So communal bathrooms, communal showers, and they have found M. leprae, the germ that causes leprosy, in those areas. So now that has informed the programs. We're doing a lot of water and sanitation and hygiene projects in India, and our research is informing our WASH projects, as we call the water, sanitation and health, is helping those to be more effective and more efficient and really get to the root of the problem and solve it. So that's one way that one of the research we're doing and how it's helping. The other thing, of course, we need to be diagnosing leprosy, and the earlier we diagnose it, the more chance we've got of avoiding the disability. If we find it early, while it's still just a skin problem, then we've got a much higher chance of preventing disability. And our team in Bangladesh is currently testing rapid testing kits that can identify a leprosy infection even before a person has developed the disease, so before the skin patches appear. And that's a game changer, really. And what they're testing involves a finger prick test. So they use a little scalpel or something to get a sample of blood. And then in that blood, they are testing different biomarkers that they can test to see is there evidence that this person is infected with leprosy. And it helps us to see, yes, they have leprosy. It also helps us to see what kind of leprosy they have so that we can give them the right drugs. So if we can actually detect the infection before the skin patches appear, then that will really help us to stop transmission. So this is the early indications and the other results from this study are really promising. So the Leprosy Mission plans to put a lot more resources and time and effort into that particular research. Another diagnostic research that we've got is in the very early days. We're still at the sort of inception part of that. And that is using scanners that will scan skin patches and use what they call spectral imaging to actually to look at the skin patches, and they'll be able to tell using software if this is leprosy or if it's another skin disease or if it's just something harmless like a birthmark or something. And the longer term plan is that these scanners will be made available as a smartphone app. Now that's a few years down the line, but that if we're able to get to that level, then we'll be able to use them even in places that has limited medical expertise. So that means that people in quite remote villages, because most of them have a phone connection, will be able to diagnose leprosy. So it's still in early days. We have no results yet, but I'm looking forward to seeing what comes out of that. And really, anything that helps us diagnose leprosy easier and earlier is going to have a really big impact and take us towards reaching zero leprosy. Mm-hmm. In our hospitals, there's a lot of studies going on improving how we treat leprosy ulcers. And most of the patients in any of our hospitals, most of them are there because of leprosy ulcers, mainly on the foot. And sadly, many of them are coming in again and again and again, either with the same ulcer or with another ulcer on a different part of the foot. And when they're in, they have to stay a long time. So it doesn't only affect them physically and medically, it actually affects them socially because they can't work. If they're children, they're away from school. So it has a lot of impacts. So anything we can do to heal ulcers quicker and, really importantly, heal them without scarring, because scar tissue will easily break open again into an ulcer, is really important. And Dr. Indra Napit and his team in Nepal are trialling a new treatment. It has a fancy name called leukocyte platelet-rich fibrin, but it's LPRF for short.
Yep.
And this is a treatment that uses the body's own white blood cells. So these are cells in the blood, and it uses stem cells, which is other small cells that we have inside our blood, and they're there naturally. His technique uses those, and then makes they concentrate them in the laboratory using a centrifuge, and then you get a mixture that they then make into a gel, and then they put it on like a plaster on top of the wound, and it heals. We're finding at the moment it heals quicker, and really important to us, it heals without scarring. So it's a much better skin than would be if it was just allowed to take time to heal. So this is showing really good results at the moment, and we're waiting for the further steps of that study to take place. And some research that doesn't take place in the laboratory or in a hospital is our research into mental health issues associated with leprosy. And in recent years, the Leprosy Mission and other leprosy organisations have become more aware of the mental health issues that people affected by leprosy and other neglected tropical diseases face. And there are many tools that have been used in other diseases to help people with mental health issues. And some of them have been adapted for leprosy. And there's a big study taking place at the moment in the north of Nigeria that's testing these tools with people affected by leprosy, people with lymphatic filariasis, which is another neglected tropical disease, and also people with other disabling conditions. And we're expecting that the first results will be published any time now. They're actually writing the papers now, because it's really important that we don't just think about the physical stuff, but that mental and emotional effects of leprosy are considered too. So that's just a brief overview of some of the stuff that we do. We do a lot more, but that's just some of it.
Yeah. No, it's amazing just to hear all of those different areas and even the amount of people that, all of this requires is just absolutely amazing. And even God's provision in placing all of those individuals and all that knowledge and all those skills that they need to make these advances is just absolutely mind-blowing, and really does just speak to God's provision for the Leprosy Mission, which is amazing. So I know there's probably so much more that you wanted to mention, because there's probably so much that we're involved in, but would you maybe share just some of the really major advances in leprosy research in the past few years?
Yeah, I think it depends what you mean by recent. But if I can go back, if you'll excuse me, going back 40 years ago, sort of the biggest breakthrough was the development and testing and rollout of multidrug therapy. And that's the treatment that we use to cure leprosy. And multidrug therapy, or MDT as we call it, became approved by the World Health Organization for treating leprosy in the early 80s. But that approval was a result of many years of research in various parts of the world, including in some of the hospitals where I worked in Nigeria. So that was a big breakthrough and came out of research. And once we had the treatment sorted, the focus of the research moved on to nerve damage, because probably for many people, when they think about leprosy, they might not think about the skin patches, actually. They might think of the disabilities associated with leprosy. And most of nerve damage is caused by something called leprosy reaction, which is a sudden inflammation of the skin, of the eyes, of the nerves, and it causes a lot of damage to those parts of the body. So in the late 80s and for most of the 1990s, we saw lots of research, again, all over the world, into the causes of nerve damage, into what the risk factors are for nerve damage. And some of the things that we found out is that women who are pregnant and women who have just given birth, for example, are at relatively higher risk of having reactions. Children going through puberty, particularly girls going through all the changes that we go through when we're young girls, are at particularly high risk. So there's a lot of research into that. And there's a lot of research into the best treatment for leprosy reaction, because these are severe inflammation. So we have to use quite strong anti-inflammatory drugs to treat them. So finding the best treatments. And this led to a complete review and overhaul of the treatments that existed then to have the treatments that we now use for leprosy reaction. And, one of the things that I'm aware of is that World Health Organization suddenly told us we needed to increase the number of weeks that we give prednisolone for. Prednisolone is one of the drugs we use for inflammation. And we had to increase it from 12 weeks to 20 weeks, because that was what the research had shown us, so that we could really knock these reactions on the head. And then in the related to reaction in the noughties, we recognised that side effects of some of the drugs we used for leprosy reaction were quite severe. So since the noughties, there have been a lot of research, and still is ongoing, into finding alternative drugs for treating leprosy reaction, and all of our research centres around the Leprosy Mission world are involved in that. And they will take many years, because clinical trials of drugs, you can't do them quickly. They're long-standing things. Yeah, so they're some of them.
Yeah, no, that's really interesting. We've recently done an interview with Amar, who works for Idea International, and it's available on our YouTube channel, and he was talking about his experience with leprosy reaction, and the way he described it has just always stuck with me. He said, I think his exact words were, it was like a blade to the skin. That's how painful it was, and just the way he described it really made you hit home actually how painful and how awful this is. And it's encouraging to know that we are making progress in trying to limit something like that just causes so much hurt and so much pain. But yeah, no, that's very interesting. And the thing with the scanners as well, when that, amounts, that'll just be groundbreaking, because that goes beyond the leprosy mission. That goes, just for health workers, that maybe don't even work for the leprosy mission, can use that and diagnose leprosy effectively. So that's amazing. We'll have to do another podcast to get that one on the list when we get there. But probably one of the most major things in my role that I get asked about, I go out and I speak at churches and like adult groups and things like that, to share about the work of the Leprosy Mission and to try and encourage people to join and enable this vision of a world without leprosy, really. And probably one of the most frequently asked questions I get asked is about a leprosy vaccine, and why there isn't one for one of the world's probably oldest diseases. And I know when church activity picks back up again and I'm out speaking, that will probably be asked even more, given that we've witnessed a vaccine for COVID-19 being developed in about a year, and how effective that rollout has been. So do you want to maybe discuss a bit about maybe the challenges that we wouldn't be aware of, and the difficulties in getting something like this?
Yeah, I realise actually it's not just one vaccine we've seen developed in a year. It's probably 5 or 6 vaccines that have been rolled out in a matter of months since the pandemic started. And however, what the newspaper headlines and the news headlines miss is the cost, the enormous cost behind vaccine development. And actually, governments all across the world have pumped hundreds of millions of pounds into developing vaccines for COVID because it's a global health emergency. So this has seen everybody put their efforts together. It's been prioritised in all the safety testing. It's been prioritised in all the ethics approval. So it's jumped ahead of other things that were already in development. So I know we sometimes hear people say, oh, they've shortcut things. So they haven't shortcut, but they've jumped the queue. That's what they've done. Other people have been asked to wait just because of the urgency situation. But there are vaccine developments going on, but any new intervention like a vaccine goes through many, many phases. And the political will and the massive finances that have enabled the COVID vaccines to come out so quickly, basically they've got through those phases quicker than usual. I don't know a lot about the vaccine development, but there are a few that I've just been keeping my eye on. And tuberculosis is a disease that other people will have heard of. And tuberculosis and leprosy have a very close relationship. They're almost like cousins, if you like, in the germ world. And there are existing vaccines for TB. Probably most of us were vaccinated at school for TB. And that one does provide, so the BCG, which is the one we have at school, does provide some protection from leprosy. But in addition, there are new vaccines being developed for TB right now. And the Leprosy Mission and other organisations have asked that the people developing those vaccines also test them against leprosy. So that, again, because they're so closely related, if we can hit 2 diseases with one vaccine, that would be excellent. But I don't know where along the road they are. I don't know what phase they're in, so it still might take a while. There's a specific leprosy vaccine, and as usual, they have long names. So I'll abbreviate it to MIP. So the MIP vaccine is one that was studied in a very large research in India. I don't think the Leprosy Mission was involved in that, but they might have been. And that has been proven to be 69% effective against M. leprae, which is the leprosy germ, for up to 3 years. So if you think about some of the effectiveness percentages you're hearing for COVID vaccines, it's pretty up there with them. And I'm told that it's now used routinely in parts of India, but that further studies are taking place. But I don't exactly know what status it's in and where that's going. But the one I know a little bit more about is one that one of our global partners, the American Leprosy Missions, has invested heavily in. So they have invested over the last 17 years, they've invested over $6 million. So this is the kinds of monies we're talking about. It's not a few pounds, which has resulted in LepVax, that's what they've called it, LEPVAX. And this is going through its phases. So the first couple of phases are safety trials, basically. So it's past the first safety trial. It's now being tested amongst people who are most at risk. And I believe there are studies going on in Brazil. I'm not sure what other countries are taking part in it. The next phase, which is called phase 2 in the sequence, would be a much wider testing on a much wider population. And it may well be that our research field in Bangladesh is involved in that, because the research program that we have in Bangladesh has the great advantage of having easy access to large numbers of people affected by leprosy and their families for many years. They can follow them up for many, many years. So there's a lot of work going on in vaccines, but it takes very skilled people, lots and lots of scientists, and it takes a lot of money. Yeah.
No, but it is so encouraging again just to to see that progress being made. You know, we probably wouldn't have dreamt about that, 40 years ago when multidrug therapy was being created, that, we'd be on the cusp of a vaccine, which is just amazing. So maybe sticking with the theme of more COVID, maybe. I know at the start we mentioned when we think of research, we think of this person sitting with their microscope. So many people might think, oh, well, how has COVID really impacted research when it's just people sitting in labs? But you've explained how it's spread over so many different areas. So how has COVID impacted our research programs?
COVID has seriously affected our research programs. If I can start with the laboratories, they've had the additional responsibility put on them by the national governments to actually be part of the COVID testing. So some of them are doing the testing in the hospitals themselves. For example, our hospitals in India, our hospitals in Nepal. But in the case of the Nepal team, I know they're also going out into the community and doing testing as well. So, they're very involved in that. And that's on top of their ordinary work, so they're really overworked and exhausted at the moment. And in addition to that, travel restrictions have meant for many of the studies, it's been impossible to go to the communities to recruit study participants and then to follow them up. Because if you're testing a new drug, you can't just test it on 2 or 3 people. You have to, depending on what you're doing, it's either a few hundred or even better, a few thousand. So that means going out into the community or calling people to come in to the hospital or wherever you are to see you. So because of travel restrictions and because of lockdowns, that hasn't been possible. And then those people who are already on research studies, they need following up, some of them weekly, some of them monthly, some of them quarterly. And we haven't been able to do that, we haven't been able to go to the villages to do that. And the international logistics network has been affected. Now, I never thought I'd say that word before because I don't have much interest in international logistics. But when I'm trying to get research equipment from one part of the world to the other, or when I'm trying to get an essential drug from one part to the other, or a microscope or whatever, suddenly all the couriers and the normal methods that we use, they are fully occupied getting COVID-related equipment from one part of the world to the other. So it's really, so sometimes we can't send it at all, or other times the price of sending it is like 10 or 20 times what it was before. It's really expensive because they're having to prioritize COVID. So this has meant that some of our drug trials, we've had to stop them because we don't have the drug in the right part of the world. Or some, like the rapid test kit I mentioned earlier, that's running about 6 months behind at the moment because of all the lockdowns that we had in Bangladesh. They just couldn't get all the pieces in the right place at the right time. So that's running behind. And last but definitely not least, a number of our researchers have been ill themselves with COVID. Rebecca, you know that, as a mission, we pray for one another daily. And we're getting, prayer messages all the time from the different countries that our colleagues, particularly in Southeast Asia, have been affected. And some of them have been quarantining at home, but some of them have been admitted to hospital and have been really quite poorly. So that means that they're poorly, they can't do their work, and then it puts an extra burden on their colleagues who are the ones left in either in the laboratories or the other parts of the research world. But having said that, despite the challenges, I'm really amazed at the initiatives that the researchers have shown to be able to follow up study participants using technology. I mean, you and I, you're sat in Belfast, I'm sat in Leeds, and we're using Zoom for this. And that's exactly what our researchers have been doing. They've been using the technology either on their phones or Zoom or otherwise to try and keep as much as possible going as they can. They've also, when they haven't been able to get out and about, they've been sat at their desks analysing the data they've already got and also writing papers for publication, because a research isn't worth anything until you publish it. so that you can tell other people about it. So particularly our Indian team, I think they've been able to bring out about 20 papers in the last few months, so they've been busy doing that. So despite the challenges, and there've been many, they've done well.
Yeah, and it's the things that you don't think of, yes, we might think of people being ill and people having to isolate, but just trying to get something transported across the world, it's just something that we probably don't think about, and how disruptive something as simple as shipping something can cause. There's just so many things that you probably don't factor in and you don't think about. But it's been interesting over our chat hearing words that are now familiar that wouldn't have been pre-COVID. You're talking about rapid test kits, you're talking about even the word transmission, we're talking about the word isolate, and all of that probably wouldn't have been as familiar before COVID, but now has been part of our daily vocabulary. And I know I did an online Zoom talk with kids, and they were primary school age. This would have been in about March or January maybe, actually, and I was amazed after the talk, the difference in the questions. Previously I might have been asked, were we talking about leprechauns or leprosy? And, now I'm being asked, how do you catch leprosy? Do people have to isolate? Do people with leprosy have to wear masks? Is leprosy infectious? And just these things are just becoming normal in our day-to-day lives. So I think this is a perfect time to start thinking about research, to really start exploring research more with our supporters, because the topic doesn't seem as daunting anymore, because we're familiar with these keywords and it doesn't seem as scary anymore. So I wonder, despite everything that has been interrupted, and I know we're talking about, we're saying COVID took hundreds of millions of billions of pounds to get all these vaccines sorted, and to our supporters, they might think, well, how am I meant to make a difference in that? Janine, you're talking millions of pounds to develop a vaccine. How can our supporters get involved with this? How can our supporters make a difference in this such a vital area? And probably to bring it back to the name, how can our supporters continue to serve from their sofas or serve from home and really help this area grow? Because like you said, we need it to reach our goal of zero leprosy transmission by 2035. So what can our supporters do?
Well, I think unless somebody like Bill Gates is listening to this, then it's not one person that's going to solve this. It's all of us putting our own efforts together. And actually, every pound or even less than a pound that somebody can put into the kitty will contribute to the research costs that we have. But really, if we are going to see an end to leprosy, then we need to find the answers to all the questions that we still have about leprosy. And I'm not the one doing the research day to day. My role is to support our researchers on the ground. But when I speak to them, there are basic equipments that they need. I mean, our Nepal research laboratory is in a building that I think is 60 years old. It's crumbling, So we at least need to have the right buildings in place with the right equipment. Again, I'm wind back the clock, 18 months. How many of us had heard of a minus 80 degree freezer? Nobody. But actually, all our laboratories need a minus 80 degree freezer. There are microscopes that are needed. There are small things like test tubes and centrifuges, but there are even things like masks and gloves and the PPE that we hear about. Our laboratories need them anyway, because they're actually handling bodily fluids anyway, regardless of whether COVID is there or not. So there are big things that we need to invest in. There are smaller things we need to invest in. And that includes buildings, that includes laboratories, that includes equipment, that includes things like data management software. In the old days, everything was done by hand and a calculator, but that, with computers, with software, things can be done a lot quicker, and we can put our results through computers. But they do cost money, or the people to actually build the programs for us, they cost money, because I don't know how to do it. I don't know about you, Rebecca, but I don't know how to do it.
The podcast is enough for me, the technology, not that.
But then we need the skilled people, and it's skilled people in the laboratories. So it's our histopathologists, it's our molecular scientists, it's our clinical scientists, it's people that know how to run a clinical drug trial, because there's a set standard way that has to be done. You can't just do it, ad hoc how you want. There's the social research, like the mental health stuff I was talking about earlier. That's a very different set of skills to the laboratory people. So actually there's a lot that people can invest in, and some of them are big and some of them are smaller. But as I said, if we all put our hands to the plough, then we'll actually be able to achieve so many things.
Yeah.
And then it's not just about money. I mean, we are a Christian organisation. Please pray for our research and pray for our researchers, because they really are, if they can find the answers, then we've got the game changing, and we will see the end of leprosy in my lifetime, in your lifetime.
Yeah, no, definitely. And that's really been a theme for us personally in the Leprosy Mission here in Northern Ireland for the past year. That during COVID we saw communities just come together to support each other and to help each other in their time of need. And to be honest, that's the exact same for the Leprosy Mission, because like you said, unless Bill Gates listening, it's not going to be one person. We need to do this together, and that might be 50p, a pound, but you might think that that's not going to help, but it will. That will make such a big difference, because together we can see an end to leprosy, which is just amazing to think that we could be a part of ending something that causes so much pain, so much hurt, on so many different levels, both physically and socially, all of those different things. It would be amazing to say that we helped, and we helped bring an end to that. So yes, just to sum that up, we can give financially to the Leprosy Mission to help equip and make sure we have the right tools and resources. But like you said, we can pray. We can pray that these specific, amazing, knowledgeable individuals come to help to make the breakthroughs, to do the research, the things that go over the top of our heads, that they know, that God would just provide those people to work for the Leprosy Mission, and also that he would just provide for us in abundance, just to be able to make this possible. So, well, thank you so much, Janine, just for joining us. You've said it all much better than I could have said myself, so thank you so much. And I just hope that everyone was blessed by this. So thank you. Bye.
Thank you. Bye-bye.
Thank you for listening to our podcast. Don't forget, if you have missed any of the other episodes, you can go back and have a listen. If you'd like more information, please visit our website, www.tlm-ni.org. Here you will find out lots of information on the Leprosy Mission, our work, and how you can get involved. There are also lots of resources available that you can share in your church or meetings. You can also donate on our website. Did you know a donation of just £24 could find and cure one person of leprosy? £70 could train a community health worker. Or why not come together with others from your church? A donation of £900 could pay for a researcher's salary for 1 month. There is no gift too small. Everything will make a difference. So thank you again for listening and for your continued support. You are truly making a difference, and your support enables all the things we discuss in this podcast. Thank you.